all the listeners of Health Education Lecture Series. I am your host, Gurdeep Singh Sandhu, homeopathic consultant, and I am here to deliver another lecture of Health Education Lecture Series in English and in Hindi. So, today our lecture is related to the highly contagious disease, viral disease, mostly affecting the children, because our chapter is still going with the children's, that newborn children may be affected with many of the diseases. So we are discussing about those diseases here. And today is the time to discuss about the polio. As far as poliomyelitis is full name, myelitis came from the muscles. Polio basically is a disease of the nervous system. Mainly the virus affects the nervous system, and ultimately it affects the muscles, muscle power, and also the reformation of muscles, and also you can say the uh, progress of muscles, bones, and everything in the affected area, because the nerves are the primarily force which supply the energy for the bones, for the joints, for the muscles, for the blood vessels, and everything in that area. Means the total control, just like a governor has a control in the state. In this way, this nervous system has a control in their appropriate limited areas. And in this way, the nervous system has a control uh, in a particular area. And if that particular area is affected by this virus, polio virus, then yes, it has effect on that part. And that part is damaged, you can say disabled. And furthermore, its development is restricted. It do not develop according to the other counterpart of the organs. In this way, the highly contagious viral disease can affect the nervous system, potentially leading to paralysis. Basically, the main complicated side effect you can see for this polio is a paralysis. And a person who had already infected by polio virus and has not been treated properly before it affects, because after that, still we say that there is no treatment. We can just manage the conditions. And if it is complicated, under those conditions, it may cause paralysis, it may cause death even, if ever the vital organs of the body, just like the heart, the lungs, kidneys, vital organs of the body are affected by this virus. Or, in other words, you can say if the nerves supplying any particular area under which a vital organ is connected, then the function of that vital organ will be disabled. And in this way, ultimately, it may lead to death. Virus spread by droplet infections from person to person. Just mostly, most of the diseases, viral diseases, they are appearing and they come on the system just like a flu symptoms. And all the flu symptoms, they are mostly spread with the droplet infections. They're from their secretions, from their sneezing, from their contacts, and all that. The same way, this polio virus, you can say, is spreading in the same way, person to person. You can say sometimes from the fecal matters. Fecal matters, or if ever any mother is taking care of the fetus, the fecal matter, and her hands are uh, infected with that one, and somehow it touches the face or mouth of the baby in this way, and that has not been taken cleaned very cleanly, that has not been washed out. Under those conditions, under those conditions, it may affect the baby. It may affect to the other children as well. So the most affected, symptomatic and asymptomatic, these are two conditions in which this polio can affect a child. And sometimes there are no special symptoms in the children's, but sometimes there are symptoms, just like I told you, respiratory problems, palpitation type of problems, and developmentally problems, development of the muscles, development of the bones, and development of the blood vessels. It's all connected to that one, which ultimately leads to paralysis. And as far as the causative agent, we have already described you, that is the polio virus. And the polio virus is causing all these type of conditions. Transmission, I told you, it is transmitted from the fecal matter of the affected persons. It may be transmitted from the droplet type of infections. And the symptoms mostly, they are maybe mild, or they may be serious. The mild symptoms, sometimes only one part of the limb or one function of the limb is damaged. Otherwise, it may be complete paralysis of any type of limbs. That's the extreme. And as I told you, it comes just like with the sneezing and coughing, and sometimes the fevers, and fever and all these symptoms indicates that it's a you can say any flu type of symptoms. And we may be misguided with that one before treating this polio. And ultimately, when this fever goes off, when the fever goes off, and we see the child, that the child cannot move his limb. Child cannot move his limb, or cannot use his limbs. In this way, fever, fatigue, headache, vomiting. All these symptoms are mostly in the flu types of thing. But the stiffness, stiffness of neck, stiffness of limbs, and ultimately the paralysis. This paralysis is a serious complication or serious outcome of the polio, you can say, which may come up in a child who had already infected with the polio virus. Sometimes this infection may be in the one section of the body, and one section supplies whatever organ, they go to paralysis, they go to incapacity of performing their duty. Under those conditions, those functions are made disabled. Just like if it is affecting the limb, the lower limbs, the sacral plexus, and all that, one or the both limbs may be paralyzed. They will not be able to, uh, you can say, work accordingly. In this way, post polio symptoms, most of the things they are recovered from. Some of the peoples, they recovered from this one, and but not all, all that lucky that they are recovered totally and they do not have any symptoms. That's why we call this asymptomatic, because the previous symptoms are mostly similar to the flu type of symptoms, and we are misguided with that one, that it may be a flu symptom. In this way, if it's not that severe, the flu type of symptoms, or the whatever the symptomatology is at that time, will go off. And ultimately we may be misguided that it is not polio unless it is checked. It's not polio. In this way, after polio, because most of the symptoms appear, complications, paralysis, all these things mostly appears when the fever goes off. Normal sneezing, coughing, all discharges, and all these things are in a routine with many of the diseases. But when those symptoms goes off, as you know, all of you know that the incubation period of the in all the viral diseases is about 4 days, 4 to 5 days, and within that periods, it starts showing up its symptoms, and ultimately, when it starts showing up its symptoms, then fever goes off, and we see that some part of the body is not functioning normally. So in this way, if these type of the conditions happens, then what we should do for this one? What we should do? So we should, for the prevention of the polio, because it's that kind of condition that it may render the person disabled for lifelong. So if it is rendering a person for disabled lifelong, that definitely we should take care of. We should be prepared beforehand for that, not to wait that if he will be suffering, he will suffer from the poliomyelitis, then we will do this treatment. Most of the diseases normally we treat when we see symptoms positively. They are tested clinically, they are verified by the lab tests, and after that, we start the treatments. But here I'm talking about the kids, newborn babies. We are not to take a risk in these conditions, because if in the preliminary stage shows just like symptoms of the flu, and we may be misguided with that one. And if we are misguided with that one, it means when the fever will go off, when the flu type symptoms go off, ultimately it may result in severe complications. Especially if it affects any particular type of horn, that limb may be disabled. If it affects particularly to the thoracic area, respiratory organs, and the heart may be affected with that areas. So in this way, whatever horn, because it mostly affects the nervous system. And previously, in my previous lectures, I have already told you about the nervous system, that the nervous system has two components. One is the cerebral, central nervous system. And central nervous system starts from the brain, and the nerves originates from the different part of the brain, and then they pass from the foramen magnum into the vertebral column, neural canal, that's known as the neural canal in between the vertebral column. And ultimately, it goes up to the end of the coccyx. And throughout its pathway, throughout its area, from the foramen magnum up to the end of the coccyx, they have different sections. And all the different sections are deployed to control the function of different organs of the body. Just like I told it many times, the cervical section of the nervous system controls the upper limb. Upper limb means the arms up to the hands, fingers. Sometimes a particular nerve, not only the total complete, a particular nerve is damaged, maybe by injury, maybe by injections, maybe by in whatever way. It may not be polio, it may not be anything else. But if ever it's damaged, particular type of organ, just like one finger, two finger, or a particular type of finger may be damaged with their function. We say, oh, this finger is having a numbness, this finger is having pain, or this finger is not working, sensationless. So in this way, it passes downward into the thoracic area, and the thoracic area has 12 different origin on right and left side, 12 right side, 12 different left side, and they control all the organs in between the chest, mainly heart and lungs. Everybody knows that. All the pleuras and the mediastinum. Mediastinum is a central piece in between the chest, which lies in between the two lungs, just in the back of the sternum bone. And from back sternum bone in front and back up to the vertebral column, it's a section. It's, you can say, I generally describe it a common pathway, because common blood vessels, common nerves, common lymph nodes, common food pipes, from upward goes downwards, and some from downward to goes upward. And that path, that's the mediastinum, that path is used by all the passengers of this way: food pipe, nervous system, blood vessels, upgoing and downgoing, aorta or vena cava means, all these things. So if ever the thoracic part is affected, definitely it's a serious type of polio, and that may cause death in the human beings, or even in the children's. That is why I'm asking, I'm saying all the times that we are not to wait, that if my child will suffer, then I will go for treatments. No, that is why that will be very late. That will not allow time for us to recover from the complications of that disease. In this way, if anything is not allowing us time to recover, time to maintain, under those conditions, we should take care of all those things possible before anything happens, before any infection comes up on the systems. In this way, regarding the polio I'm talking about, if it is affecting the lumbar area, it will affect all the abdominal organs, all the abdominal organs. And you know, the most part of the abdomen is covered by the intestines, small intestine, large intestines, and they have their different functions. We have already described all those functions in the intestines. And also it has a you can say the peritoneum, it has the kidneys, it has the adrenal glands, and also in the lower section, because the upper abdominal area has all these things: the stomach, small intestine, large intestine, and portion of the large intestine. Also, the liver and spleens are also covered in the lumbar area. In this way, you can well imagine, if poliovirus is affecting the lumbar area, definitely any of these organs or all of these organs may be affected and may be disabled to work normally in their functions. In this way, it's very serious. In this way, it will become very serious to recover. In this way, you have to take care properly for this one. Okay, so sometimes this connection goes off and I have to take care of this thing time and again. Most people complains that the voice is less. If ever you feel, all those who are listening the program, if ever you see and the voice is not normal, you are not getting the voice or anything, you can call me and tell me on the other phones, so that we can do whatever we can do for that one. So now, description of poliomyelitis I have already told you, and the physical description of the polio I have already described about you. This virus is a so tiny virus, the diameter of 25 to 30 nanometers. And about this one, I have told you about the causative factor of the diseases. What causes the diseases? We know the fungus, visibly outwardly. Fungus is visibly outwardly on the skin folds and all that. And the second minute thing you can say, but not the minor thing, that is the parasites. Parasites are inside inside our abdomen, but they are not smaller. We can see them by eyes. And these parasites can cause damages from the inside. Fungus can cause the damages from outside and go inside, and the parasites can cause the damages inside and go outside. And after that, the minute thing which we cannot see by our eyes, and they are capable of producing diseases with more virulency as compared to the parasites and as compared to the fungus. They are more virulent, they are more dangerous, and that is known as the bacteria. Bacteria are the microscopic organisms, and they are more dangerous as we cannot see them, and they spread very widely and mostly the bacteria has their specific site inside our body. Specific site inside our body. Just for example, I can say you, it's not that they are only localized, they remain localized, not at all. Just like tuberculosis, the acid fast bacillus. If ever anybody says, oh, he's suffering from tuberculosis, first of all, immediately our mind goes to that, oh, he may be having some problem in the lungs. A layman can understand if TB, he may be having some problem in the lungs. And after that, we know that this tuberculosis bacillus can affect the bones, can affect various other organs in later on. But the effects of tuberculosis, the fever generalized, malaise generalized, weakness generalized, anemia generalized, all these symptoms are generalized features of the tuberculosis. Same way, all the bacteria, Diplococcus, Staphylococcus, wherever there is a pus formation and all that or inflammation, they are found there. If there is a pneumococcus, that is found in the lungs as well. If there is a gonococcus, that's found into the genital organs as well. So in this way, I can say that the bacteria, which are microscopic organisms, they are having a particular site inside the body, though from that particular site, they affect the generalized system of the body, and they are more virulent as compared to the parasite, as compared to the fungus, more dangerous. And ultimately, beyond that limit, beyond the limits of the bacillus, there are viruses. Viruses are more virulent, viruses are more dangerous, viruses are like, you can say, immediately, just like earthquake comes and can kill you. Many people will be killed, many houses will be damaged, many trees and electric poles and everything will be damaged within a few seconds. And this type of organisms, they can cause heavily damage into the system of our body. That is why I recommend that. And one more thing I would like to say about the viruses, I have already told in Punjabi sections that viruses are homeless creatures. Viruses are homeless creatures. Means, just like I told you, fungus, we can find it on the skin. Parasites, we can find it in the intestines. And bacteria, we can find in a particular site in the body or the organs. But viruses are not having their proper site inside the body, and that is why they are called homeless creatures producing serious diseases. And where they live then? They live into the bacteria. They make home into the bacteria. And suppose if in any body there is no bacteria, external bacteria, which is responsible for producing disease anytime, though they are latent. They are at latent stage, they are not producing at time any problems, but they are still there. Just like most of the vaccinations, booster doses are given inside the body and they remain inside the body, though they are not producing the diseases at that time, but sometimes they are protective. If the natural disease comes up on the system, then they protect the systems, but they are still there in the body. They are still the home vacant home, you can say. They are still the vacant home inside our body. When you take some booster dose of any bacteria, against any bacteria, any booster dose has a proper site for the viruses to develop inside that body. That body will develop viruses inside that. And second thing we say, the incubation period. The incubation period is stated as time period when a virus enters into a body and is capable of harming that body. Before that, it's not harmful. Before that, it's not producing any particular type of symptoms. But after that incubation period, 4 days, it is now in a capacity. If it is still there, otherwise it will go. If it's still there, it means the virus has its home inside body somewhere where there are bacteria inside the body. In other words, bacteria are the home site anywhere. If bacteria are in the genital organs, gonococcus, it will get the home. If the bacteria are pneumococcus, they will get the home in the lungs. If the bacteria are acidophilus bacillus in the bones, they will get the home. So wherever, if ever inside the body they get any home in and inside, and most of I have told you that the booster doses of the all the bacillus when given, they make a proper and permanent home inside the body, permanent resident inside the body, though they are not capable of producing diseases, but they are the proper site for the viruses. When COVID-19, everybody knows about that one. When COVID-19 came, not all the people were died. No, most of the people and all those people who were affected were died because they were having the hosting capacity. They were having the hosting capacity means the bacteria inside their body, and those who survives even after suffering with the COVID-19, they survive means their viruses entered the body, but within 4 days they do not get any proper hosting site inside the body. That is why they could not work. They could not work, and they could not cause any reaction. They could not cause any side effects. And people's after 4 5 days, fevers, malaise, tiredness, and they are okay. But those who are having bacteria inside their body, yes, viruses inside those bodies started their functioning virulently and produces their severe symptoms, symptoms of respiratory organs, symptoms of various blood connected diseases and all that one. And you know that that was very dangerous thing. But now today we are talking about the poliomyelitis, polio virus. Myelitis is attached to this polio because mainly this structure is constructed by the bones, and bones are controlled by the muscles, and muscles are controlled by the nerves, and nerves are centralized and the vertebral nerves. And in this way, if the total centralized nerves are affected, because it may produce encephalitis. Encephalitis means when the coverings of the brains, where there are many organs inside the brains, cerebrum, cerebellum, mons, medulla oblongata. There are many things inside this skull, and they all the organs are covered in their membrane that is known as the meninges. And when this poliomyelitis affects those meninges, those type of things, they affect the organ functioning of that organs, and ultimately the nervous system has impotency, has weakness of that type. And ultimately, the canals issuing from Pakhda do not have the normal supply, and cannot irrigate the proper land and all that, whatever they should. The same way, when the nervous systems are affected, wherever, from where it is affected, the distal portion from that one. Proximal means the closer to the central section, and the distal means away from that. Just like heart is our central area, and anything away from that is known as distal part. The same way, the nervous system affected at whatever site produces the symptoms of poliomyelitis in the distal part of that, from that area. Means if it is affecting the central nervous system, every organ will be paralyzed, and ultimately it will produce death, because heart cannot pump normally, because the lungs cannot give proper oxygen which is required, so everything will be stopped. The same way, if it is affecting the bones, mostly the vertebral column, ultimately the vertebral column, which is the central pillar for our body, it cannot stand that. Scoliosis, and there are many more other things which happens with this one, and ultimately it happens with this one. uh, Ultimately, when any call comes in between, then it's very difficult to rejoin it. So luckily we join it. So in this way, uh, when any part of the vertebral column is affected, the distributors issued from that area of the nerves are affected, and the organs which were supplied from that horn, from that junction, are damaged in their function. They cannot control their normal functions. In this way, the poliomyelitis becomes serious depending upon the area where the virus has affected. And in this way, mostly whatever we have noted that people are handicapped. One or two legs, they are not moving. They are paralyzed legs, and they cannot walk normally. They cannot sit normally even, and they are crawling in their lives. But we do not know much about the damages of the internal organs. Yes, we know persons were dying with this poliomyelitis if it is affecting the internal organs, as I have given you the descriptions, that if it is the poliomyelitis is affecting the thoracic area, definitely the thoracic area controls the major organ of our body, heart, lungs, and I told you mediastinum, there's the common pathway in between the chest, from which joined the head from the lower area of the body, and from the lower area of the body to the head. Most nervous system, blood vessels, lymph channels, food pipes, everything passes from the mediastinum. That's the common pathway. And if the thoracic area is damaged, you can well imagine what are the functions. But mostly these type of peoples died, and we do not know. The general public do not know. General public can see that, oh, one person is handicapped, his leg is poliomyelitis, and he cannot move that legs, he cannot put pressure on that legs, he's handicapped, disabled, you can say, since birth. The child is disabled since birth, and we can see them even growing with that, because all the other areas are okay, growing with that with the shortening of one leg. It was not developing normally. It was not functioning normally. But the internal organs, when they are affected by polios, we cannot see that. And if we cannot see that, it means the serious organs are concerned with that one. And the serious organs are the major axis of our life, and when they are the pillars and they are damaged now, well, imagine people's lives. In this way, first of all, the affected area with polio is called the throat. Dry cough. First of all, a child starts with dry cough because coughing is an automatic action which is being taken by the body automatically. Just like something happens to our nose and our finger goes to the nose, something happens to the eyes automatically without thinking, it goes to the eyes. Just like you are driving in a car and you are talking to somebody, you are talking with full conscious to the person sitting next to your seat, but somebody comes in front of your car and immediately your foot will go to the brake. Automatic process, because body learns all these things automatically. Body learns all these things. In this way, many of the things body learns since birth. Since birth, they learns. The same way, even the newborn child, it learns. Body, his body learns all these things, that if ever anything is abnormal in the eyes, hand goes to the eyes. Anything happens with the nose, hand goes to the nose. Anything happens to the throat, it is coughed up. Cough, cough. And it's a natural process. It's not that child has to be trained to cough. No, it's natural, automatic process. In this way, the first effect of the poliomyelitis, we see it is on the throat. And after that, the second major effect is on the intestines, though they are centralized. And I should not give the less weightage to the brain, but everything runs from the brains. Okay, brain, meningitis, meninges, encephalitis, all these things. But if those things happen, these are beyond the visibility of normal person. A normal person cannot see that because those people die with serious facts. So in this way, we do not recognize. We recognize only those things with which a person, a child is surviving and is handicapped and is disabled with some type of functions, but still survived, still in life. In this way, the spinal cord, if it is affected, you can well imagine there are 26 vertebrae joining to each other. Basically, there are 33, but some of the vertebrae, just like the coccygeal, four vertebrae joins and one forms one, and then the lumbar vertebrae, the five, and they join one becomes one, and the nerves are issued from that one. In this way, from each vertebra, there is a gap that's filled up with the disc, intervertebral disc, and there are openings from where the nerves can pass outside and can control their specified areas in the body, specified organs inside the body. And in this way, you can well imagine from neck to downward, all the portions are supplied with the orifice from where the nerves are passing to the periphery and controlling the different organs. It means if any of the portion of the vertebral column is damaged, forget that the nervous system is okay. Nervous system is coming from the brain, it's okay. But if it is affecting through the particular type of nerves which is controlling the functioning of the vertebral column and the development of the vertebral columns is damaged, then in this way, some one bacteria may not develop in a normal conditions. There are different kind of conditions. I have already, in my previous lectures, I have given the description of the problems of the vertebral column, and that what type of diseases vertebral column has and how we can find it out and how we can treat all those things. But here we are talking about the poliomyelitis. And just well imagine if one bacteria, one vertebra is not formed normally, canal, just like bent of canal is broken, water will flow out. And ultimately, the water which is flowing inside the neural canal, that's the CHF, that's flowing inside that one, uh, cerebrospinal fluid, that's flowing inside that, but that is covered in a membrane. And if the bone is not formed, membrane is visibly outside and just covered only with the skin. And you can well imagine, if there is no tire, there is only tube. Can you run long with that tube only? Can you drive your car or bicycle with tube only? No, not at all. The same thing happens if there is a scoliosis in the vertebral column because of the poliomyelitis, and some one bacteria somewhere has not formed fully, and there is open gap. There is open gap, and there is only membrane which is just protecting the inside fluid, cerebrospinal fluid, CSF, which is common in the vertebral column and also in the brain. And all the brain organs, inside them there are ventricles, just like the streets in a village, and they are filled with a fluid that's known as CSF. That CSF is flowing inside the brain, in all the organs, and also passing into the vertebral columns to maintain the pressure, to maintain the you can say the garbage inside that one. And it's the way that the extra garbage is released from there, and a fresh protein, fresh diet is accumulated inside that CSF. This is what sometimes doctors take injections into the vertebral column in the backside, and then they draw a fluid and they test it, especially in case of meningitis and all those things. The same thing in polio, we do that. So in this way, so whatever section of the body is affected by the polio, the function of that area is damaged, and it depends, the complications depends upon the area, which area has been affected, whether it's a vital organ. Suppose if leg is not here, yes, person can survive. If one arm is not here, person can survive. Even if arm is there but it's not working, even then people survives. Leg is there but it's not functioning normally, people survives. But there are some major organs, if they do not work, even if they do not work properly, because it's a normal quantity that the heart should work 72 to 80 times per minute. There is a normal quantity of respiration that a person should breathe 14 to 16 times per minute breathing rate. But if these organs are affected, it means the major part of the life function is destroyed, and those type of persons cannot survive. The causative factor is the poliomyelitis. So spinal cord and all that. It's spread mostly, I told you about the from the stools, from the droplet infection, from the sneezing, from the discharges and all that, and from person to person. If a person is infected, one more thing, when person to person, I'm saying person to person, it means I told you that there is an incubation period. All the time I'm repeating this incubation period. Repeating of incubation period means that you cannot see signs, symptoms in between that periods that a person is affected with some type of bacteria or viruses or any type of infection. Means symptoms are not visible clinically, or even we can prove it in the lab as well. Sometimes doctor says, you say, I'm sick. Doctor say, okay, go to the lab, check the lab test. And the lab test report comes, you say, oh, everything is normal, you are not sick. But the patient say, I'm sick. What is that? It means it was still an incubation period. It was still going on in your system, and your system is combating with that one. Symptoms are not produced that you may be diagnosed for a particular name of the disease. And that incubation period, particularly in the case of viral diseases, I'm saying about the polio, that most of that period, incubation periods, we should be careful, and especially the care when you are traveling in air, when you are traveling in a bus, when you are traveling in a you are coming from a crowd, attending any crowd, you do not know how many people were suffering from any type of virus, or a particular type of virus, or maybe the polio. And you have a incubation periods, you will not produce the symptom. Even in your crowd where you were, they may be having infection, but they are not showing the symptoms at that time because they were in the incubation period. It means they are carriers. They are carriers. And this is the folly, that during the carrier periods, they can infect another person. And you are coming from those people that you are infected now, but you are not having symptoms. And you will not have symptoms for 4 days. But you are touching your someone, loved ones, who is just born. You may infect him. And ultimately, it may happen that even after 4 days, if there is no bacteria, you do not suffer from any complications. But your loved one may suffer from that. Therefore, I request to all the persons, so whatever measures at that time medical science has, you should apply that. You should make use of that one. That's the vaccination. That's known as artificial immunity creating process. Immunity, which is given by the parents and child born with that. That immunity was sufficient when he was in the mother's womb, because everything was given, food was given prepared, air, oxygen, blood, everything was given prepared in the blood. But now the child has come out, food has changed, environment has changed, diseases are changed, there are different diseases in the environment. So in this way, the immunity, that's known as innate immunity, which he was having from his parents, his mother, you can say, is not sufficient. After birth, it is not sufficient in the change environment, in the change food style, and in the change living everything. In this way, we have to protect them, and we have to provide them artificial immunity. This vaccination process, immunization, this is known as immunization, to make immune, to make protected. So this immunization is a process of different vaccinations, which a medical science has learned so far that these are the diseases which were killing the newborns, and we were not having any sources to protect them at that time. But now we have, and that's known as the isopathic system. This isopathic means whatever is causing the disease, we are deploying the same type of force inside the body, but that force is not capable of producing disease inside the bodies, but they can react, they can act against the environmental type of bacteria or viruses at that time. It means we introduce inside the body a dead type of bacteria, a non-living type of viruses, so that they go inside the body when body was healthy, and they were not sufficient in quantity to produce, they are not sufficient to produce a reaction to produce the disease at that time, they were in small quantity. But our body responses, even a small particles of the dust comes into the nose and we irritate, we rub the nose. But these are nanomicroscopic organisms. Bacteria are microscopic organs. The viruses are nanomicroscopic organisms. So we introduce nanomicroscopic, that type of bacteria of particular diseases, which we have learned till now that they are causing the death of the children's. Then we do introduce that type of dead bacteria, dead viruses inside the body, so that body erects at that time. Though it's not harming us, it's not harming, but they are entered into the body, and body immediately react against that. It means the center is created. A center is created, just like we have civil police that take care of the civil matters. Then we have a border security force that takes the matters of the border security force. But if anything goes beyond from the civil, from the border, from the everything, then CRP comes, and then after that the military comes. So there are sections of protections, but this is the initial protection. This is the initial protection we are doing in different sections for different diseases, for different viruses, and we are arousing the vitality of the person, of the newborn, that if ever he is affected with this type of bacteria from outside, the body is already prepared for that. Body is already prepared to protect from that one. So this is the process of immunization, of vaccination. And as far as about this vaccination, I told you, none of this type of vaccination is forever. Just like you go to the, you see the ads, people give ads, money back guarantee. There's a money back guarantee. So they say that no, after that we guarantee that you will not suffer from polio, that you will not suffer from any type of hepatitis or any type of diphtheria or tetanus or whooping cough. And no, it's not. Temporarily, time being, time being means we have a limit of our vaccinations. We have a limit of our vaccinations that they can protect you. Till that, suppose a child is protected in his childhood, and ultimately his immunity will develop according to the new environment, according to the new food materials. Ultimately, he will be more efficient to control all these things himself. But even then, it has learned by the medical science that he may suffer from these kind of diseases time and again in his life if anything suitably arouse that bacteria, arouse that viruses inside his body. Means he is reinfected. He is reinfected with that type of things. Just like tuberculosis, people are being treated by the tuberculosis, and ultimately, after sometimes again, they need to get the treatments. Why? Because they are again exposed to the environment which previously has caused the tuberculosis in that persons. Once with the treatments, we have controlled that. But after that, if the immunity of that person has not developed up to the mark, and he has introduced to any environment the previous type of environment which produces tuberculosis in this body, he may suffer again. The same way, just like people, everybody knows about that. The Mata, Khasra, measles, everybody knows about that one. Varicella. A person suffers one time in a life. This is what we know about. But it's not. Nowadays, it has been recorded that this kind of virus diseases can affect the person 2 or 3 times in their life. Ultimately, how long is a life? We have a limited life. And if we say a vaccination can protect a person up to 20 years, till 20 years, either that person will have his own sufficient immunity to combat this type of diseases, because all the people did not suffer from the COVIDs. All the people did not died with the COVIDs. Even after they were having COVID, or even in one family, there were COVID peoples, but all the people were not died because they were having their own individual immunity to fight against that one. In the same way, if once you have been vaccinated, once you have been protected from a particular type of disease, it means a limited period you are safe. For a limited period, you are safe. But ultimately, at that time, two things will happen. either your body will become competent to fight this type of infections, it means your immunity will increase, or you may suffer or you may need again the vaccinations. And most of the vaccinations have their duration up to many years, up to many decades. And how long is our life? Just like I just talked about the measles and khasra mata, all of you know about that, that once you suffer or twice you suffer, after 10 years, after 5 years you again suffer. And ultimately that virus, zoster, that zoster virus remains latent inside your body. And if ever a suitable environment comes after 50 or 60 years, you may suffer, but the name of the disease will be different. Shingles. First of all, we say measles, khasra, mata. Different names are given to that one. But after 50 or 60 years, the same virus is erupted again in the body due to suitable environment or due to reinfection from someone, and he suffers from the similar type of eruptions on the body, just like in the measles you see that, in the khasra you see that red spots and eruptions comes up on the body, face, everywhere, and the same thing, but they are having a different pattern with the same virus after 50, 60 years of age, and the name is given shingles. So in this way, there many more viruses may occur in one life time and again, but we assume that once a person is protected with this immunizations for a longer period, he will be safe from that kind of disease. Till that, number one, his immunity will be increased to fight against this type of viruses, this type of infectious diseases. Or this disease may come in a different form, or this disease may not be that virulent, that dangerous for him, because now the immunity has strong, protection has strong. Or, in other words, you again need re-immunization, just like for the shingles we give it. Shingle vaccinations are given to the elderly persons when they are suffering from again similar type of disease as they suffer in their childhood, measles, khasra. So in this way, regarding this polio, I told you about the polio virus. It's a nano measurements. Oh, we cannot see in a microscope. And special microscope is required for that one. And also, it's a spread, I have told you. Mostly, it's in the children, but it's not that adults cannot get the polio. Adults can get polio. Yes, underdeveloped countries like Nigeria, like Pakistan, like Afghanistan, these type of countries having more cases still at present. Now the vaccination is worldwide, but even then they are not having sufficient quantity of that kind of medical science that their children are protected. They have still all these things. Okay, ultimately in 1365 BC, we learned about the polio, that it was there. Since then, this polio is affecting to the humanity, and since now it is stopped, not completely stopped, but still we have the cases. If peoples are coming to America from other countries where any disease has not been eradicated vastly, just like peoples come from India, here, they try to test for tuberculosis because tuberculosis has not washed out in India. Still, there are cases. It means when any person is migrated from India to here, then they check it whether they are having any tubercular type of things in his body or not. And ultimately, they clear him by X-ray, by sputum test, by blood test, and everything. Then they say it's okay because we have a booster dose. Lode, you might have known about that. Lode were given in the in the shoulders at that time. That was a booster dose. Okay, so that protect us for lifelong. But even then, when we comes here, those bacteria are still inside our body, but in that shape. When they check tuberculosis here, that becomes inflamed, and they say, "Oh, you are having tuberculosis. Your test of tuberculosis is positive." Basically, they are not having tuberculosis, but that is because of the booster dose they was given in the India. But still, all the persons coming from these type of countries, Nigeria, Pakistan, India, they are not Afghanistan. They are not free from various of the viral diseases. That is why their immunization record is checked repeatedly. Have you ever been given MMR? Have you ever been given DTP? Have you ever been given polio? Have you ever been hepatitis? All these things are checked repeatedly. That they, when they enter into the American community, they should be free or they should be protected already from all these diseases, and then they are accepted as a green card holder. Then they are accepted all these things. So today our time is over. Tomorrow perhaps I have take up the Hindi time as well, because it was a long lecture and there are many things I want to discuss with all of you. You should know, because these are general things. My purpose for these lectures is to convey you the maximum knowledge with which you can protect yourself and also to your nearest and dearest, especially the newborns. Okay, so after completing this vaccination immunization records, we will go to the protection of our toddlers. What are the diseases my toddlers can suffer and how we can protect them? That will be our next chapter. And after that, when a child becomes adult, in that case, what type of problems he may suffer and how we can take care of our in Punjabi it's known as hundred hale person, when he is not quite young, but he is not toddler as well. Okay, at the age of 12, 13, 14 up to 15 is a section of age where we need to take more care of our kids. And if we are able to take care of our generation at that age, it means our foundation of the children is strong. Our strong foundation of the children will build up a good society, healthy society, especially. Healthy society will have good mind and the development. So God bless you all. This is Gurdeep Singh Sandhu, your homeopathic consultant. After teaching about 26 years in medical colleges in India, I'm here in America since 96. And since then, I'm teaching my community in Hindi, Punjabi, and English lectures every day from 5 to 6 p.m. And all the radios, TVs, many more at this time, even Radio Pravaz, Radio Punjab, Radio Sabrang, YouTube, Facebook media, and most of the newspapers, they are delivering my lectures just for the betterment of the community. And this is what I can pay back to my community, that I want them, that they should be aware of all these things and they should be protected from all these diseases. So if ever you have any problem anytime you want to discuss with me, yes, you can call 408-687-1899. Or if you want to be treated with the scientific homeopathic approach, you can call 408-687-1899. God bless you all. We'll see you tomorrow with the next lecture of health education lecture series, how the life was created and how the life was developed and what were the stages. Time to time he suffered with the diseases and what we can do for those diseases. Thank you all.